Hello everyone, my name is Marion Robertson and I am the wife of the co-founder of Insulin, Sir Frederick Banting. Just like my husband, I am also a medical scientist. However, my life's work is to further understand the risk factors of diabetes and further learn how we can diagnose it.
Good afternoon, I'm Margaret Mahone, an epidemiologist. The work of my husband, Charles Best, inspired me to further develop research to better understand the multifactorial nature of diabetes, particularly its risk factors and the best treatment methods. Type 2 diabetes is considered a multifactorial disease due to the variety of socioeconomic, behavioral, and genetic risk factors that influence disease occurrence and progression. In Canada, type 2 diabetes is the seventh leading cause of death and costs the healthcare system over $12 billion a year. As the prevalence continues to increase, it is important to understand diabetes better so it may be treated and prevented more effectively. Because diabetes does have multiple factors, it is important to analyze them all to determine how at risk someone may be for diabetes, and then what steps can be made to reduce that risk. It's also needed to confirm why a patient may have developed diabetes. A lifestyle analysis includes looking into behavioral and lifestyle factors that may increase susceptibility to diabetes. This may include having a sedentary lifestyle, where caloric intake exceeds output and increases the prevalence for obesity, another major predictor of diabetes. Sedentary behavior is increasingly prevalent with technological improvements. Food insecurity is another major predictor of diabetes. People that are food insecure are 2 to 3 times more likely to develop diabetes. Often the food insecure are those that are low income, non-white, smokers, less active, obese, and have lower quality diets. A person's genes are able to increase their susceptibility to diabetes by up to 80%. The thrifty gene hypothesis suggests that some people are able to process foods more efficiently than others, which can increase fat storage. Even when diets are equal, some are more likely to gain weight that can lead to obesity, a risk factor for diabetes.
B-cell dysfunction is a primary factor in developing type 2 diabetes. B cells are found in the pancreas and are responsible for producing, storing, and releasing insulin. Often with a B cell dysfunction, there is insufficient insulin, causing an increase in blood glucose levels. Another risk factor for diabetes would be the presence of underlying disease, such as hypertension and cardiovascular disease. Up to 85% of people with diabetes have hypertension, and 50% diagnosed with hypertension often have diabetes as well. These comorbidities are so closely linked that it is important to test for one in order to prevent further complication.
The final of the major risk factors is race and ethnicity. Diabetes is more prevalent among African Americans, Hispanic, as well as Aboriginal populations. There are several reasons this may be occurring. Many traditional diets and lifestyles are becoming westernized. These ethnicities are often associated with lower income and higher inequality.
It is very important to analyze all aspects of a client's life to see what risk factors they may have and how they may make a client more susceptible to obtaining type 2 diabetes. Once the risk factors are identified, it makes it easier for the healthcare team to test the individual and potentially diagnose them. There is difficulty in diagnosing diabetes as definitively one type. However, proper diagnosis is important in developing a treatment plan. There are 4 ways to diagnose diabetes: a fasting plasma glucose test, a glycated hemoglobin test, we can screen for gestational diabetes, and we can complete a lifestyle analysis. The diagnosis of diabetes is made when 2 separate blood tests show that your fasting blood glucose level is greater than or equal to 126 milligrams per deciliter. 2-hour postprandial blood sugar measures blood glucose exactly 2 hours after you begin eating a meal. Glycated hemoglobin, or A1C, has several advantages, including greater convenience, greater pre-analytic stability, and less day-to-day worries during times of stress and illness. However, these advantages may be offset by the lower sensitivity of A1C, greater costs, a limited availability of A1C testing in certain regions of the developing world, and the imperfect correlation between A1C and the average glucose in certain individuals. In a first prenatal visit, tests should be performed to potentially diagnose undiagnosed type 2 diabetes. Between 24 and 28 weeks of gestation, testing for gestational diabetes should be performed if the woman has not been previously diagnosed with diabetes. Women diagnosed with gestational diabetes should be screened for persistent diabetes at 6 to 12 weeks postpartum using the oral glucose tolerance test and clinically appropriate non-pregnancy diagnosing criteria. Women with a history of gestational diabetes should have lifelong screening for the development of diabetes or prediabetes at least every 3 years. Also, women found to have prediabetes should receive lifestyle interventions or metformin to prevent diabetes. A lifestyle analysis is a simpler test used to diagnose type 2 diabetes. It is used to look at behavioral risk factors that can lead to diabetes, such as occupation, food intake, and physical inactivity. Once completing any one of these 4 tests, the diagnosis of diabetes will or will not be present. However, if diabetes is present, it is extremely important to diagnose the correct type of diabetes in order for an individual's healthcare providers to devise a proper treatment plan.
There are 2 possible treatment plans that can be developed: traditional and intensive. Many studies have examined the differences between traditional treatment and intensive treatment regarding increased life expectancies and the differences in the prevalence of associated diseases. The traditional treatment approach typically involves family physician treatment only, usually with oral medication or insulin injections, with the potential of having a specialist referral if needed. There's also a recommended improvement in diet and increase in physical activity. The intensive treatment approach is a much more individualized treatment plan, created through individual risk assessments, patient education, motivation, and strict target goals. These are often developed with close contact with the patient. This plan will often begin with dietary interventions recommended by a nutritionist, often targeting fat intake, a recommended 30 minutes of moderate activity, 3 to 5 times per week, available smoking cessation programs, psychological assessments if mental health is a concern, and drug therapies if the lifestyle interventions are unsuccessful. Intensive style treatment looks to confront major lifestyle risks that contribute to diseases. Patients that have gone through intensive treatments live an average of 8 years longer, are more likely to survive a cardiovascular event, have less severe and later onset kidney disease, eye damage, and nerve damage, all associated with diabetes.
The multifactorial nature of diabetes means that there is a much greater risk of more people being affected because many experience at least one risk factor that contributes to diabetes. It also means that there is no singular approach to diagnosing and treating diabetes.
As with many chronic diseases, diabetes included, maintaining a healthy diet, getting adequate physical activity, and not smoking can improve all aspects of health and maintain health for longer.